A warm welcome to all our viewers to our series Natural Medicine. I was allowed to choose a topic today which is about what makes us old, or what makes us age quickly, or why do some people age faster than others, visibly. And that's a topic I'd like to discuss with a naturopath today. And you will know why I chose him. That's obvious soon. Welcome, dear Meinhard Klobs. Thank you for being here. Sure. Now, look at both of us, dear viewers. I'm 51 and my guest is 61. And my daughter's just laughed back there and said, "He looks younger than me. It's not possible." Incredible. Really? 61? Yes, almost in a few months, exactly. And first of all, thanks for having me. With pleasure. Now, tell me, what did you do? Well, the subject of aging, or staying young, is certainly a complex story, which can't be fixed at only one point somehow. And I think genetics also play a certain role. But in our experience, there are also the fundamental aspects that we consider in naturopathy. There are any toxins or acids in the body, or it's overloaded with acids on the one hand, or lacking vital substances and vitamins on the other hand. In our experience, this definitely plays a major role. Also, how functional are the organs that are responsible for detoxification, like the liver, the kidneys, the lymph, spleen and so on, and for food intake or vitamin intake, the small intestine in particular, so stomach, gastrointestinal tract, and keeping these organs fit plays a role. And certainly another aspect is the psyche. Can I relax enough? Can I get enough sleep and so on? This is, of course, related to the first 2 points. If vitamin D is missing, magnesium's missing or something, then you have sleep disorders much faster, or melatonin. For example, we might get into that a bit more, which is a very important aspect for aging. Melatonin. I only know melatonin in context as a sleep hormone. That we sleep well, and when the light comes back in the morning, melatonin production goes down and, well, we wake up. In connection with rejuvenation or with aging, I've never heard it. Can you explain that to me? Yeah, exactly. So melatonin, as you correctly say, is the hormone that controls the sleep-wake cycle. The release of melatonin then shuts down the body. And then it comes to tiredness in the evening or at night. But melatonin also plays a very important role in eliminating free radicals in the body. So ultimately, also to prevent serious illnesses and also to supply the body with energy and the production of ATP in the mitochondria, so that in the power plants of our cells, ATP, adenosine triphosphate, is produced. This in turn stimulates the oxygen utilization and oxygen formation in the cells, and these are very important effects to keep the cells fit, young and healthy for as long as possible. Now, you mentioned the free radicals. I know that nowadays we all create a lot more free radicals for environmental reasons. Simply because these interference fields, the stress fields, are getting stronger, and free radical means that an electron is missing. So it tries to steal it somewhere to actually be satisfied. And melatonin therefore has one more electron to give it up, or does that work via other cascades? Yeah, well, melatonin is definitely crucial for ensuring that enough ATP is produced in the cells. And when melatonin production decreases, and it decreases physiologically shortly after puberty, for example, around the age of 20, melatonin production begins to decline. And the older a person gets, the less melatonin they usually have. That also means that they sleep less then, accordingly. Exactly, and as a result, older people often have sleep disorders. Exactly. You could say geriatric insomnia. Exactly. Okay, you can control that with, let's say, with bioidentical hormones, yeah? Yeah, melatonin is produced in the pineal gland, also called the epiphysis. It's a little gland which is pretty much in the center of our brain. Has the shape of such a small pine cone, hence the name. The Latin term is also glandula pinealis, and that's where the pinealocytes are formed. And these, in turn, control melatonin production. And that can be stimulated in a targeted manner. And we also talk about the cell tuner, for example. Or when we talk about the cell tuner, Professor Ewald Paul already wrote several books on high-frequency technology, or healing, or disease treatment using high-frequency technology 100 years ago. And with one book, he was exclusively concerned with, it's called rejuvenation through high frequency, and that together with medicine professor Eberhardt in the 1920s. I know this book. We have it on the homepage. It's an old book from 1935, 33 roughly, isn't it? No, from the 20s already. Exactly. And they already established at the time that the pineal gland, so where melatonin is produced, that this is one of the two organs which is crucial to stop aging. But it's never really an issue, you know. I never hear about that. Even in the medical community, I don't hear anything about the pineal gland. Does it even exist in academic medicine? And what's it good for? Yeah, it's known there, of course, that the pineal gland controls melatonin production. That is very clear, but it also has a much higher meaning. The pineal gland is the regulator of all regulators because it controls almost all other glands and checks their functionality and balances them out. For example, the thyroid, pancreas. So almost all glands are controlled by the pineal gland. And what kind of circumstances are there that the pineal gland no longer functions 100% but less? Well, it's precisely these aging processes that take place in the body. So a completely normal development that actually the function is reduced in everyone. Yeah, but of course the aforementioned factors play a role again. Do I have too many toxins or acids in the body? Do I lack vital substances? And fluoride in particular is suspected. So what is still an ingredient in toothpaste today, even though there are many fluoride-free toothpastes. So the knowledge is already gaining ground. Without saying that the other was bad, you just change it and don't say anything. Exactly, but that can already be determined that this has an impact and that it calcifies the pineal gland. This is also seen in imaging processes such as X-rays or CT. You can determine that the pineal gland calcifies with increasing age and therefore can fulfill less of its function, the melatonin production and also control of ATP synthesis. And now in this book by Dr. Ewald Paul. Dr. Paul describes that you can stimulate this pineal gland again with high frequency, or that you can free this calcification again. Yeah, exactly. Professor Paul and Professor Eberhardt, they just said back then it's important to activate the pineal gland with high frequency in order to stop the aging process. And the other organs are the testicles in men and the ovaries in women. So pineal gland plus testicles or pineal gland plus ovaries. These two organs are considered to be of fundamental importance in order to control the aging processes. Okay, interesting. Now the testicles are added. Again, please, the connection between the testicles and the pineal gland. Enzymes are also produced here. Yeah, the sex hormones are essentially produced in the testicles. And they obviously have not only the function of reproduction, but also a strong impact on the aging process. At least that's what the two of them recognized back then and just recommended to give special treatment to these points. Now, of course, there are not just these points, but also, of course, it is important to keep the lymphatic system and liver and kidneys and heart in function, to slow down the aging process. As I said, the pineal gland and the sexual organs. Let's stay with the pineal gland again. If it becomes calcified, how do I get rid of this layer of limescale? Yeah, calcification also occurs through various things in the body, including, on the one hand, through heavy metals or halogens, such as fluoride, for example, but also through vitamin D deficiency, or magnesium deficiency, or K2 deficiency. They're all crucial in naturopathy, but not only naturopathy. Even conventional doctors have the vitamin D level checked today, when people tend to osteoporosis, for example, because it's precisely vitamin D, K2, and magnesium that are important, so that the calcium in the body comes to the right places, so that it gets into the bones and teeth and doesn't cause a calcification somewhere in the arteries or, for example, in the pineal gland. But if you already have it and now have sleep problems or age faster than others, can you then get rid of this calcification of the pineal gland? Well, you can obviously reduce it again, in any case, with this high frequency. And of course, in general, it's rarely the case with health problems that only one point is crucial. Today, there are probably the most renowned researchers in the field of aging or rejuvenation. These are the Swiss-Italian Dr. Walter Pierpaoli and the American, both doctors, Dr. William Regelson. And they've worked intensively with other doctors for over 30 years, but these are the leading ones who have published a lot. For example, a book, Melatonin, Key to Eternal Youth. So this is a work by Pierpaoli and Regelson. And they ultimately came to pretty similar conclusions, namely also that the pineal gland and melatonin production are crucial for controlling the aging process. Now you keep hearing melatonin, and in America you can get it from wholesalers in every mall. And with us it's forbidden. Yeah, exactly. It is, of course, always better when the body can produce the substances it needs by itself than supplying them from outside, regardless of whether it's natural or chemical-based. And as I said, at that time, 100 years ago, Professor Paul basically recognized that high frequency can stimulate the pineal gland to enforce increased melatonin production, and can probably also stimulate decalcification, because the two are closely related to each other. Would you have ticked off the sleep problems too, right? That plagues so many people these days. Yeah, exactly, but as I said, it's also often a lack of magnesium. Magnesium is also important for good relaxation, muscle and nerve relaxation. Vitamin D is important. In any case, that's also our experience that these two factors, and certainly a few others. So the more toxins I get out of the body, the more the body can relax. So, for example, we have a doctor who came to see us last year. She looked closely at the device. We treated her, then she said, "Order me a device." And she told me that she has a patient who takes antidepressants. And as long as she comes to her regularly and undergoes treatment, she doesn't need any medication. So there too, the nervous system can regenerate and relax. But everything is interrelated. It is simply crucial to keep getting the toxins out of the body, because they ultimately put a strain on the organs and also the nervous system, and then probably also accelerate the oxidation processes. Free radicals are formed more, and then, logically, cell aging takes place faster. Yeah, exactly. So detoxify again, and add the things that are lacking. And take care of the pineal gland. And this means clearly no toothpaste containing fluoride, although this is, as we said, actually still scientifically controversial. But one should rather let that be, from your point of view. Yeah, there is no discernible benefit. I mean, for a long time, young children were given fluoride tablets and so on. But today it's no longer entirely clear whether this really has advantages or whether it doesn't bring more disadvantages. And I've had very good experiences with it myself. So I've been using the device for about 3 years now. And you mentioned it at the beginning, that I might not look as old as I am. So I actually had grey hairlines here too, before we had the cell tuner. So we've been doing detoxification for a long time and added vitamins, but we've now had the cell tuner for almost 3 years. And then at some point I realised that the grey hair had become the normal hair colour again. But it certainly all takes time. I've earned every grey hair. It's granted to you. But it's amazing. In fact, I really don't see any grey hair. Indeed, well, how do I get this high frequency to the pineal gland to improve my body's melatonin production? Yeah, it's very easy. So you can use this antenna. Maybe you can share that too. Let's quickly show you a short video. Exactly. Now we see how the energy transfer takes place there. And you put that on the pineal gland? Exactly. Either here in front, where the forehead crease, the third crease in the area of the third eye, or then from behind. So I actually always do it alternately. For every treatment that I do, 1 minute from the front and 1 minute from behind. And then the testicles too. Yeah. Does it get warm? Yeah, it gets warm sometimes. Exactly, yeah. That's a diagnosis again, when it gets warm. Yeah, exactly. That means something needs remedial action. Yeah, exactly. The cell voltage has dropped a little. It doesn't get hot, and not always. There's also the effect that more often you treat yourself with the cell tuner, the faster the body regenerates. So if I had 3 weeks of vacation and didn't treat myself, although we actually also mostly take it with us on vacation, but if I haven't used it for a few weeks now, then I notice in a few places, okay, it gets slightly warm again, but that's usually gone after 1 or 2 treatments. And at the beginning, I also had a few points. It took weeks before there really was no more warmth. So initially it was, for example, in the liver and gallbladder area for me, but that's always been my subject. It got hot, and after about 2 months it was completely gone. And since then I haven't had any more problems in this area. It's a cool thing. Mr. Tesla was a genius. Yeah, absolutely. I read now that Donald Trump has released hundreds of Nikola Tesla patents. So I think we can be very excited to see what will come next. Yeah, exactly. Did you read it too? Yeah, I read that too. You never know if it's a fake if you read something in the media. Today, you can't believe everything, but ultimately you have to do your own research. That's also what we always say to our patients or friends. Don't believe us. Listen to this if you're interested in what we have to say. Listen to what others have to say and form your own opinion. Yeah, that's a great quote. We also have that at QS24 to represent another point of view, to simply give a second perspective to the existing mainstream opinion. And that's how you find your own truth. But you are the living example that it works. By really detoxifying and adding good minerals, adding what's missing to free the pineal gland, and then you can actually undermine or reduce this aging process. At least that's our experience that we have so far, and especially with ourselves. And I can say that I feel fitter today and younger than 10 years ago. So in this respect, you have a good chance that you will feel better in 10 years. Yeah, I think I still need a little exercise. I sit here too much. And you don't have any sleep problems, do you? No, I don't have them anymore, but I used to have them too. Especially around the liver time, according to the Chinese organ clock. 2 o'clock, 3 a.m., it's liver time. So that was a time when I woke up a lot. And since I started therapy with a device there, with the cell tuner, I no longer have the problems. But maybe also in addition, with increasing melatonin production, as I said, the body is always a total work of art, and it's very rare that only one component is decisive to improve a situation. Usually there are several somewhere, and that's why, from our point of view, it's simply important to make a good diagnosis. And we do the same with our patients. Thorough medical history, checking, are there any acids, toxins in the body, how can we get rid of them, are vitamins missing, how can you supply them in the best way, and then organ regeneration with the cell tuner. And this combination's just great. But it's not an everyday topic for a naturopath, the anti-aging problem, is it? No, it's not a problem that we are pushing, but it just happens. As I said, the patients come and say they just have these and those complaints, and as I said, then we do a thorough diagnosis and then recommend various things. And depending on the situation, not every patient wants or can implement this at all for different reasons, because there's not enough money for vitamins, or because there's not enough time or whatever, or they can't come for treatment or something. Then you always have to try to make the best of it within the framework, or of what's possible. But if someone can do all of the things, then you clearly have great successes from time to time. Dear Meinhard Klobbes, thank you very much for these descriptions of a path that can lead to this, dear viewers, that you can reduce the acceleration of the aging process, or even have the chance at 61 to look like my guest. I think that's really great and admirable, and I wish you, on your way as a naturopath in Germany, a lot of fun and good luck. I don't know where we're going with naturopaths in Germany. Not easy at the moment, but in the end, I always say, whoever heals is right, and I'm not for parting. I'm for the union of this knowledge. So, all the best for the future. Thank you. And you too, dear viewers. We'll see you again soon. See you next time.